Good morning. I am Anslin from nursing tutor from Emmanuel Arthur College of Nursing. Now we are going to see about subcutaneous injection. Subcutaneous injection is administered into the fatty layer of skin directly below the dermis and epidermis. Subcutaneous injections are highly effective in administering vaccines such as measles, mumps, rubella, and medications such as insulin, morphine, diacetyl morphine, and goserelin. Types of syringes for subcutaneous injection. Insulin syringe. This holds maximum of 1 ml of medicine. The syringe has marking from 10 to 100. The marking at 100 is the same as 1 ml. Tuberculin syringe. This syringe holds up to 1 ml of medicine. It has a needle that is slightly lower than an insulin syringe. The syringe is marked every 0.1 ml. Sites of subcutaneous injection: abdomen at or under the level of belly button, about 2 inches away from the navel; arm, back or side of the upper arm; thigh, front of the thigh; buttock. Imagine a line that runs across the back just above the crack between the buttocks. An injection may be given below the waist and above this line. Indications of subcutaneous injection: severe dyspnea, swallowing difficulties, mouth, throat and esophageal lesions, intestinal obstruction, profound weakness, poor absorption of oral drugs, unacceptable number of oral medications, unconscious patients. Advantages of subcutaneous injection: safe and easy route, slow and sustained absorption, self-medication is possible, prolonged duration of action, foul-smelling and irritating drugs can be given. Disadvantages of subcutaneous injection: painful, skin pigmentation, hypersensitivity reaction may occur, large volume of drugs cannot be given, discoloration of skin may occur, irritation, infection, tissue necrosis to the site of injection may occur. Complication: severe pain, redness, swelling or bruising, skin irritation, thrombus formation, pulmonary embolism, allergic reaction, restlessness, tenderness may be experienced, soreness or bleeding. Precautions for subcutaneous injection: subcutaneous injection are inserted at 45 to 90 degree angles depending on amount of subcutaneous tissue present and length of needle. Do not aspirate. It is not necessary to aspirate because the epidermis and dermis is relatively without vessels. Review lab values and assessment data prior to injection. Example: insulin. Avoid sites that are bruised, tender, hard or swollen. Be careful when preparing and administering high alert medications. Essential steps for administering subcutaneous injection: check for administration rights. These are: right drug, medication, right client, patient, right route, right dose, right time, right assessment, right approach. Right education, right prescription, right nurse clinician, right principle of care, right evaluation, right documentation. Equipment needed for subcutaneous injection: syringe appropriate for the needle for the medication being given, needle, alcohol pad, medication ampule or vial, disposable gloves, kidney tray, one sterile gauze or cotton piece, one tray. Procedure: wash hands to minimize risk of infection to the patient, don gloves, check the patient's identification, position patient either sitting or lying down, check the drug formulation, indication, route, volume and side effects, assess the skin and the patient condition, prepare the patient, clean the area with an alcohol pad in a spiral motion, clean outward 3 inches. Assess the client into a comfortable position, relax the arm, leg or abdomen, distract client by talking about an interesting subject or explaining what we are doing step by step. Injection administration procedure: consider rotation of injection site and assess those that are repeatedly used for injection. Hold the syringe between thumb and forefinger of dominant hand like a dot. Pinch skin with a non-dominant hand. Inject needle quickly and firmly at 45 degree to 90 degree. Ensure the fold of skin is injected into and released only when the needle is removed. Wait at least 10 seconds before withdrawing the needle. Do not massage or rub the site afterwards unless otherwise indicated. Reassess for therapeutic effects and or any side effects. Assess the client to be in comfortable position. Discard the uncapped needle and syringe in a disposable needle receptacle. Remove gloves. Wash hands. Document accurately and appropriately. Thank you.